Hello and welcome to today's episode of Together San Diego. Thank you very much for joining us. I'm Paola Hernandez Jayo. Our guest today is Dr. Christian Reimers from Family Health Centers of San Diego. Please help me in welcoming. Good morning, doctor. How are you?
Good morning. Buenos dias. Good to be with you.
Buenos dias. Good to see you as well, doctor. I'm having a little bit of issue with your connectivity. I think it's coming back. There we go. You're clearer now. Thank you very much for joining us, Dr. Reimers, today from Family Health Centers of San Diego. Today, we're going to talk about the COVID-19 vaccine. You're going to share with us in particular information about the how the infectious disease is affecting our community. You're a specialist in that, and how Family Health Centers of San Diego is tackling vaccine hesitancy, targeting the vaccine to the most vulnerable populations, and also providing life-saving treatments. Can we start a little bit with the different populations and the underserved communities?
Sure. So, we live in a really rich and diverse community here in San Diego, and we know that the Latinx community makes up about 33% or so of those around us, and African American and Filipino and lots of different communities. And what we've seen with COVID-19 is that this disease really affects different populations differently, and it has to do with how it's transmitted, and really more importantly, how we are able to protect ourselves. And what we've seen really throughout the pandemic is those that work in essential worker jobs where they don't really have an option to protect themselves, have to come and work, have to work in person, they are much more at risk of acquiring COVID-19. In addition, and household transmission has been another issue as well, and people that have, that live closer together or that live in smaller apartments or multi-generational families also probably have higher risk as well. And so because of the jobs that people have and because of the makeup of those roles in society, we've had really an unequal effect of the pandemic on different racial and ethnic groups. And it's really the definition basically of a health disparity where we've seen, even though the Latinx community makes up 33% of the population, it's really been 55% of the cases in San Diego have been amongst Latinx people, 51% of the hospitalizations, and unfortunately 44% of the deaths. So really a disproportionate burden in the Latinx community here in San Diego.
And I know you're making an effort directly through the Family Health Centers of San Diego to help with these disparities and also with the vaccine, especially with vaccine hesitancy and also misinformation that is out there about the vaccine. Can you share about this with them?
Sure. So right from the beginning, we are a community clinic. We have 23 sites throughout San Diego, and many of the neighborhoods that we serve are enriched in people of color. So we really felt like it was up to us, working with our local partners and with the county, to really offer first diagnostic testing. You'll probably remember, last year when it was really hard to get a test, we stood up our testing really right away and, started doing our first test almost exactly a year ago, March 12th, and diagnosed our first case in March 14th. Really offering high volume testing at 4 of our sites in the community. And then when the 2 other really important things for COVID would be treatments, and then eventually vaccines, along with information. So we've been really trying to put out good, scientifically valid information on our website. We've had people out at our testing sites doing, boots on the ground education as well. And then we've had really trying to make all of our providers really on the same page with the latest information. And so I've been conducting every week in the beginning and then every 2 weeks, really scientific updates for our staff so that in the individual exam room or during the individual telehealth visit, our providers are going to be up to speed on the science behind testing and transmission and quarantine and all of those issues, as well as the vaccines. Now, on that final page there, the vaccines, we vaccinate a lot in our normal life as a community health center, lots of influenza vaccines and pertussis vaccines and tetanus vaccines as part of our regular primary care effort. And incorporating our COVID vaccine into that normal infrastructure and normal machinery is something we've been able to do just recently as the supply of vaccines has gotten better. So most of our clinics now are actually offering COVID-19 vaccines, both the Pfizer, the Moderna, and the Johnson & Johnson, really at our different sites. But of course, there's a lot more urgency and we have to step things up even more than that. So we've had a couple of sort of larger vaccination sites, one in the southeast region of San Diego in the Gateway community, and the other at our flagship clinic, our first clinic that started back in the 1970s in Barrio Logan. And with some of those bigger sites, we've been able to do up to 2,000 vaccinations in a single day, and really targeting our populations, our underserved populations, our patients, but in addition, opening up to the other communities surrounding us. About half the people we've vaccinated thus far have been our patients, and half have been other community members. We've vaccinated almost 30,000 people, 36,000 shots in 30,000 people, really as a service to the community, and really the best way to protect people from this disease. And I'd say finally that in terms of those that are hesitant, many communities are suspicious of authority, and they need that one-on-one conversation with their provider. We've been really trying to do that on an individual level, whether at the mass vaccination site or in the individual exam room, with really good, solid scientific information that these vaccines are highly effective, they are very, very safe, and we're really there to answer all the individual questions and get around that hesitancy.
Thank you, doctor. And also, it's very important, even though we're in the stage right now of vaccination, that if people still have the symptoms, that they need to go get tested, because there's a treatment. And speaking to you, you informed me that there's a limited amount of time where they could get this treatment. And also, can we talk about the cost of that treatment?
Sure. So this is, I think, the best kept secret in COVID, and it shouldn't be, that we have a really highly effective treatment that works really early in the disease to prevent people from getting sick and prevent a severe case. And this is something the general class of drugs is called monoclonal antibodies. Now, how these work is these are developed in a lab, and they have to be infused through an IV, and they basically help the immune system to fight off COVID and prevent people from getting sick. Some people get really sick after about 7 to 10 days of having COVID, but the timing is critical. So this treatment is only authorized in the first 10 days of illness, and really the earlier you can give it, the better. If we can get this into people, infused into them really within a couple of days of them having symptoms, they have a much higher chance of not getting sick. And so what does that entail? That means as soon as somebody gets symptoms, they really still do need to go take a test. Our test turnaround has been very quick. So within a day, they'll have a result, or if they do a rapid test, they'll have a result within 15 to 20 minutes. And then we can immediately schedule that person to get this potentially life-saving monoclonal antibody treatment. We've seen very good results with it. We have 2 locations throughout the county that we offer this, and have infused about 150 people, most of them very high risk with diabetes or obesity or older age, that really give them a high chance of ending up in the hospital. And we've only really had 1 or 2 people out of that 150 that have still had to go to the hospital. But to your point, people still need to go take a test if they have symptoms. The sooner the better. Testing is still available. There's been a little bit of a decreased emphasis on that with all the vaccines going on. Especially if somebody has not been vaccinated, they definitely need to go get a test as soon as they get symptoms.
Thank you, doctor. And also, let's talk a little bit about the vaccine. I know there's multiple types of vaccine. There's a vaccine card that is given. Can you talk to us a little bit about that?
Sure. There are currently 3 authorized vaccines. They're known as Pfizer, Moderna, and Johnson & Johnson, or Janssen. We're offering all 3 of them at our clinics. Often you won't necessarily get to choose which one, but I would say you don't really need to choose because they're all highly effective and very, very safe. They have slight differences between them. For example, the Johnson & Johnson is just a single shot, whereas the other 2 are 2 separate shots that are spaced apart by 3 to 4 weeks. And like I said, we've given 36,000 of these, and so we've got our routine down really pretty well. My main message is that this is the best way to protect yourself. And even if you don't think you're at risk of COVID-19, we've seen many people that are young and otherwise healthy and get COVID-19 and then end up with persistent symptoms and something called long COVID. So for example, this can be brain fog, or it can be chills, or just fatigue, or difficulty sleeping. So there's a lot of reasons for really everybody to get vaccinated, not only to prevent community transmission. If you don't get that sick yourself, maybe you'll get your mother or your grandmother sick, and then they could have a much harder time with it. So really getting the whole community vaccinated is our goal to really get to the other side of this pandemic.
Also, doctor, right now, a lot of locations are opening. It's been deemed safe. It's important, I think, to mention what are your recommendations on continuing to follow the precautions, the recommendations, the social distancing, wearing a mask. In other words, not to let our guard down. What's your recommendation on that?
Well, you said it very well there. I don't think we can let our guard down. This pandemic has had a curveball at every turn. We just heard that there's new variants that are being discovered here in San Diego that may be more transmissible. They may be harder for our immune systems to fight against. And those fundamental public health things of social distancing and of staying home when you're sick and getting tested when you're sick and wearing a mask, they're still going to work no matter what variants are around here. So my advice is definitely get vaccinated. That's people that are vaccinated can actually be around other vaccinated people, and you don't necessarily have to do all these things. But when people are certainly out in public, you can't look around and tell who's vaccinated and who's not. Really a good idea to keep those masks and keep that distancing happening.
Thank you, doctor. And also, I would like to mention that Family Health Centers of San Diego has bilingual staff available as well.
Yep, definitely. Actually, most of my patients are Spanish speakers.
Can you talk a little more about this?
Sure. I mean, our staff generally comes from the communities that we serve. So the majority of our nursing staff really is from the neighborhood. We are a true community health center. Most of our staff speak at least 2 languages, if not 3. We have lots of immigrant and refugee communities that we take care of, and we really like to have our staff be the face of the community as well. So it's responsive to the community, especially in language, and to be bilingual and bicultural is a really important part of that. One small point I wanted to get in there about vaccines before we leave that topic. Vaccines are free of charge. There's no charge at all to get it. All you'll be asked is, are you a resident of San Diego? We do not require a social security number or anything like that. So really everybody should not be afraid to come in and get a vaccine with us.
Thank you, doctor. And on screen, I'm sharing your website, fhcsd.org is where folks can go for more information on these services. Something else you would like to add to close, doctor?
Really just that people, it's been a really, really hard year. I think a lot of people have suffered both physically from the disease as well as economically from all the hardship and losing jobs and that type of thing. I would just like to say we're almost there. There's been a lot of good news recently, mostly because of all the vaccination that's happened. If you are on the fence or if you're hesitant, just talk to your provider. Hopefully they can answer your questions. Vaccines are incredibly effective and incredibly safe and really the best way out of the pandemic. But if you do get sick, we're here for you as well. So please come in and get a test and we can take care of you and get you this early treatment if you need it. But just hang on for, I think, a couple of more months. When we get more of the population vaccinated, we'll be able to get on the other side of this pandemic.
Thank you very much, Dr. Reimers. I greatly appreciate the time that you spent with us, and I appreciate the work that you do in our community at Family Health Centers of San Diego and your entire team there, helping to support our community during this challenging time of this pandemic that we're passing. I also want to thank all of you, our viewers, for watching today. I'm Paola Hernandez-Jayo. Thank you very much for watching today's Together San Diego. You may watch more of our episodes at SanDiegoUnionTribune.com/TogetherSD Live. Have a good day. Thank you very much, doctor. Have a wonderful day.
Thank you so much for having me.
News is more important today than ever before.
I'm currently outside Otay Mesa Detention Center.
I'm about to get a report at Sharp.
Out at Sunset Cliffs.
COVID testing site.
We live for these times when we're able to bring the news into the homes of people who need it the most.
I thank all of you for supporting our work.
When you subscribe to the paper, you're telling us that you believe in what we do.